Thank you very much. Good morning or good afternoon, perhaps already for you. Thank you very much for the invitation. I'm pleased to be able to join this meeting together with my colleague Ricardo Valente, who has made another presentation. And I don't see Ratsvan in the screen, but I believe he's also there. So I would like also to thank him for inviting me.
I'm here. I'm here, Rui. Thank you for allowing me.
Thank you, Radvan. Good to see you, and also Dimitri, you are both there. My greetings to both of you. It's a pleasure also to see you, although I'm not able to be with you today. But I don't want to repeat what my colleague has mentioned. Of course, I would like to congratulate you for holding this initiative, and of course the focus on patient safety is paramount for our work in the regulatory authorities. So we are sharing this very concrete objective towards giving the highest level of confidence to patients in terms of the medicines they are using in our health systems. And I think here we are in front of a system that is, of course, high contributed to this process. Not willing to repeat what has been presented, and I just would like, before I make a few points, to acknowledge the excellent work that we've done together, and also to greet Ricardo for the way that we have been able to work together in as he said, in a very pragmatic way, with our the objectives in mind. So we were very sure of what we had to do. So, and this brings me to the first message I wanted to give, which is the focus that we have to maintain in terms of guaranteeing, of course, the implementation and the functioning of the system by all parties. This is crucial for the objectives of the system. We all know there are studies with figures in terms of falsified medicines and their impact, both in terms of the safety, but also in terms of economic impact. So first point is this: it's very important that we are all focused on the implementation and ensuring that all parties are working in this direction. The second message I wanted to make, and this is also on the points of the program, so in terms of the future developments and future uses of the national medicines verification systems, it's, of course, I think we are now 4 years since the start, so we are in a different phase, and I think we have now to look into the tools that we can draw from here in terms of our own activities, which are very much related to the supervision of different areas. I mean, in this context, all of us know very well the difficulties we are having in terms of the supply of certain medicines, which of course also bring risk into the system when these situations occur. So I think now it's very important the reports that the system is able to generate, either more focused in terms of the identification of potential falsified cases, or more directed to pharmacoepidemiology, or also connected with our own systems of reimbursement. This is just to name, to refer to some specific ones, because there are many others, and within these areas also different reports. So I think this is now something that we have to look at and use in a way. I think here there is room for future developments, and again here very concretely focus on the needs of our systems, both in terms of availability and also in terms of traceability of the process. So I think this is a very important element that and I think this is very timely that you are promoting this discussion, because I think this is the right moment also to look at this aspect, since we are now also a little bit more free to these discussions, because the pandemic is giving us more room for looking now at other aspects. And the third element that I would like to highlight, which comes also a little bit from what Ricardo mentioned in terms of the way we have worked together, and I think this was very important for the implementation, because I think we all face that the system is not easy, as been said, and probably the other presentation will, as mentioned, the same. There were difficulties that we had to overcome. So it's very important that we keep this good collaboration and good cooperation. And of course, here I'm not referring only at national level, where each of us has this responsibility, but also at European level, and we are here three national competent authorities together, so we can of course also work on that level. Of course, with the other players, the European MVO, the European Commission, etc., all the different organizations. But this is crucial to continue this and reinforce these levels of action. I also would perhaps mention here a word in the moment we are in terms of looking at the review of the European legislation. Of course, it is not specifically focused on this aspect, and there will be a moment for looking specifically at that. But I think it's also an opportunity for us to see whether this is an opportunity to consider any specific element during the discussions, because of course the Commission will present the proposal. A lot is already in the public domain. Let's see what will be the final text that will be submitted to the Council. But we, as members of the Council, can also make improvements and make proposals. And I mean, both Ratsman and myself, we have this responsibility in ensuring in different moments of our presidencies this discussion in Council. And I think it's very important that the Council has an active role in the discussions, and I think this is also something that we should see if there is any opportunity that we have to use. And I think I will leave my notes at this level. I want again to congratulate you on this initiative, which I think is really very important. Of course, I will be very happy to answer any specific questions that you may have. Thank you very much.